The South African government was accused of crimes against humanity today by a leading AIDS activist in the country over its response to the HIV-AIDS epidemic. 5 million people are HIV-positive in South Africa, but the government opposes universal access to antiretroviral drugs known as ARVs. As Hilary Andersson reports from Johannesburg, drugs that are saving lives in developed countries are being denied to the poor.
Today's sermon, the people's hearts are leaving God. Worship the Lord with deeds, not words. Zibuse Dubi is being buried. He was 37. The village thinks a spell was cast on him. They won't name the spell as AIDS. He leaves 7 children behind and a wife. The wave of death is underway in South Africa. Whole populations are dying. Millions are already carrying the virus. Their only hope now is treatment. This is Zululand, a land that breathes lushness and life. For over a century, migrants have come here to work the sugarcane fields. Now they come to work in the factories. The migrants carry the virus, and the grim joke is that if you come here to work, you never go back.
This is the town of Mandeni. It has a population of about 150,000. Now, South Africa's government won't release local-level HIV statistics, but we've been to hospitals around here, and what they estimate is that about half the population of this town is walking around carrying the virus. Now, that information is reliable, and the statistic is staggering, because what it means is this. In just over a decade's time, if nothing's done, around half the population of this town, a town the size of Reading, will be dead.
This is a hospice for the dying, a place from which few return. Thabisile was brought here 2 weeks ago. She's in the final stages of AIDS. The slightest movement hurts. The nurses think her nerve endings have become infected. She's dying because she couldn't afford the drugs that would have extended her life by years. She was found abandoned.
I was in pain, coughing and suffering. There was no one to look after me. Sometimes my neighbors brought me food, but often they didn't. I was like that for 6 months.
Nkosi, her 2-year-old, won't leave his mother's side. No one at the hospital knows what to do with him when she dies. Thabisile's told them she has a relative somewhere, but her story's not coherent. In Mandeni's hospital, no one gets free antiretroviral drugs except pregnant mothers, and that only started here 3 months ago. Still, it's hard to persuade even mothers here that AIDS is real. The government has questioned the connection between HIV and AIDS in the past, and the people are confused.
So this is our pharmacy.
The drugs that are being given to the pregnant women have the chance of the mother passing the HIV virus onto her child.
So this is what the pill would look like. We would just give her a piece, and she takes that home. 200 milligrams.
That's it, simple.
That's it, simple as that.
This is an AIDS test. In 3 minutes, the death sentence shows. The staff here say they could easily administer the life-saving drugs to everyone infected in Mandeni if only they had them, but the government won't accept this.
There's a gap between what the hospitals sometimes think they can do and what in reality happens. Because if you went to the same Mandeni, to the same hospital, it's a different thing between doctors, whether they've got the capacity to administer drugs to patients. It's another thing whether those patients have got the support mechanisms to make sure that they take those drugs regularly, they are able to be monitored properly, and we've got the outreach programs.
It's been 15 months since the government officially recognized the benefits of the drugs.
We probably couldn't roll out therapy to many of the people who need it at this stage. But that's no excuse for not starting. We have seen it happening in the private sector, and I think there is evidence that you can start doing it. If the house is on fire, you don't stop trying to put it out because you haven't got enough water, or you don't think you've got enough water for the whole house. You actually start somewhere, and I think that is the message that we need, is that we make a start.
Sibonge's 30 years old, and unlike the vast majority of South Africans, she's on the drugs. She's bought up to a decade of life because she can afford to. Sibonge's well educated, she has a good job and private medical insurance. In South Africa, the rich HIV carriers live, the poor die. It's that simple.
I used to be admitted in the hospital, but since I get the ARVs, like this year, I never visit the doctor. I feel much better, and my results showing that these ARVs are working very well.
Can you live a normal life?
Yes, I'm living a normal life. I can say I'm like an HIV negative person.
Tabasile is the same age as Sibonge, and the hospice nurses have just told us she may not survive the next few weeks. Nkosi sits close. 600 people die of AIDS in South Africa every day, whilst Thabo Mbeki's government hesitates to provide treatment.
Who lives and reigns with you and the Holy Spirit.
In the last 4 months, more than 100 people have died of our own members because they don't have access to medicines. And we face death on a daily basis in ways that I wish the government would see. I really do.
Until you agree to give us medicines.
Zaki Ahmed is HIV positive. He's rallied AIDS activists in South Africa and says his people will take to the streets again if the government doesn't promise a nationwide drugs program within days.
The drug cost per person.
His organization's just been leaked this internal government report, which shows that 1.7 million lives would be saved within 7 years if the drugs were given to everyone. Or, as the government eerily puts it, almost 2 million deaths would be deferred.
You know, if you use Orwell, it would be Orwellian government speak.
The government's kept the report secret since May.
It shows that it's feasible, it's clinically possible, it's affordable for government, and it shows that we can save millions of lives in South Africa. That report undermines every irrational belief that has been held by our government, by President Mbeki, by the Health Ministry and so on. And we believe that government is delaying this report, or the release of this report, or acting on it, because there's a core of people in our government who do not believe that HIV causes AIDS.
The government admitted to us that they could now afford a mass handout with the new low price of the drugs, but still, they might have other plans for the money.
If you asked us in health today that we had another extra 2 billion to put in our budget, would we buy antiretrovirals or would we do other things? We've got major parts of South Africa where people just don't have access to safe water, can't even begin to think about antiretrovirals in that environment. But put that aside. We have nevertheless begun the process of engaging the issue of antiretrovirals.
God of mercy, hear our prayers and be merciful to your Son, whom you have called from this life.
Back in the hospice, the virus has claimed one more victim. The government believes that lives like his couldn't be prolonged by the drugs alone. The drugs don't work without proper nutrition and clean water. This man leaves behind another orphan. The children in this classroom were asked which of them had lost one or both parents. 1/3 of them put their hands up. The shocking thing is that in just over a decade's time, this will be the picture across South Africa. There will be an orphan generation, 1/3 of the country's children unable to play a full part in their country's future. The government report admits that with the drugs, almost 1 million children would be spared orphanhood this decade. 1 million extra orphans spell massive social and economic breakdown. South Africa is the economic powerhouse of Africa. but the factories here are losing productivity. The World Bank has just predicted that as things stand, this country will lose half of its per capita income over the next few generations.
If nothing is done, then South and Southern Africa faces an economic, development, humanitarian and governance catastrophe of unparalleled magnitude. This epidemic is a Darwinian event.
Tabasilwe has now told the nurses in the hospice that she has other children. But her mind is failing her. Her time with Nkosi is running out. We travelled far into the countryside to see if we could find Tabasilwe's missing relatives. We found her quarters here on a sugarcane farm. It was in this room that she'd laid for 6 months, lying in her own feces with Nkosi by her side. Here, in this valley of death.
I could not look after her. I could not even feed her. I earn 2 pounds a day working in the fields. I have no money.
This is Tabasilwe's mother, who lives next door. She's been left with Tabasilwe's 3 other children. We asked her if, when her daughter died, she'd taken Nkosi too. She told us she'd managed somehow.
Throw him with him in the unity of the Holy Spirit.
Tabasilwe is too ill to know the worst. She doesn't know that Nkosi is starting to show the first signs of AIDS. Without the drugs, his fate too is sealed.
Forever and ever.